Ladies and gentlemen, family and friends, scholars and dignitaries, welcome to another episode. Welcome to my world.
Hello, friends. So one of the greatest concerns we have, not just in America, but throughout the world, is birth defects. And one of the greatest causes of birth defects, and the only one which is preventable, is fetal alcohol and drug effects, or FADE. If you are a parent or expecting a child, you would do anything to make sure that your baby is born healthy and not in the category of special needs, a category of physical and neural development that can last a lifetime and cause a lifetime of problems and misery for those born with it. So you need to know that alcohol, cocaine, narcotics, and both stimulants and depressants can cause a wide spectrum of fetal effects and disorders. And there is an abundant number of studies and journals demonstrating the harmful impacts that infants will suffer because mothers use these substances during pregnancy. Now, let's talk about one drug in particular that's often overlooked: marijuana. Now, I've spoken numerous times before about the side effects and serious adverse effects from marijuana use. After years of research, it's now common knowledge that marijuana use causes dependency and addiction. It causes a wide variety of emotional, mental, and psychiatric illnesses. It causes a wide range of social problems and social and family dysfunction. And it causes a host of physical problems, including lung damage, cancer, heart disease, and to some extent, even brain damage. Both the American Medical Association and the American Psychiatric Association strongly advise not to use marijuana at all. In fact, every medical association and health organization in the world, including the World Health Organization, similarly recognizes the dangers and cautions against marijuana use. And that brings us to the one area that is the most commonly overlooked: marijuana use during pregnancy. Did you know that routinely between 5 and 7% of pregnant women continue to smoke marijuana throughout their pregnancy? And one study found that in a state that had legalized marijuana, up to 20% of pregnant women had marijuana in their system at the time of delivery. Well, they have no idea what they're doing. We now have strong evidence of adverse neonatal effects related to marijuana use during pregnancy. Studies show that marijuana may seriously affect fetal development, lower birth weights, a shorter gestation period, major malformations, and the occurrence of miscarriages increases with marijuana use. Cannabis smoke can cause both mutations and birth defects, depending on the dose and duration. And there is a small but growing body of evidence that indicates subtle but apparently permanent effects on memory, information processing, and executive functions in the offspring of women who use cannabis during pregnancy. Prenatal cannabis exposure is associated with overall fetal growth reduction, including decreased birth weight, reduced length, and smaller head circumference. And a recent study of 5 million births in California from 2001 to 2012, published in Addiction and funded by the National Institute on Drug Abuse, just confirmed that. It also found that up to 7% of the pregnant women used marijuana throughout their pregnancy, and that many were addicted or had a cannabis use disorder during their pregnancy. And that study found that for those whose moms used marijuana heavily during pregnancy, their babies had a 35% higher risk of death during the first year of birth. And a study published by the National Institute of Drug Abuse substantiated these findings and also found that about 20% of pregnant women 24 years old and younger screened positive for marijuana. It is so alarming that both the American College of Obstetricians and Gynecologists, the American Academy of Pediatrics, the Food and Drug Administration, and the U.S. Surgeon General recommends against the use of marijuana for women trying to get pregnant, during pregnancy, and while they are breastfeeding. And even the March of Dimes, an organization that's almost 100 years old and dedicated to the health and welfare of mothers and babies, states that marijuana is a drug and that it's comprised of over 500 different chemicals, and that marijuana use can cause a variety of problems, and that no use of marijuana has been found safe for use during pregnancy. And the Substance Abuse and Mental Health Services Administration published a review about use during pregnancy. They equated use with fetal growth restriction, a greater risk of stillbirth, preterm birth, being born before 37 weeks of gestation, low birth weight, long-term brain development issues affecting memory, learning, and behavior, and they caution against the use of marijuana if breastfeeding, as the THC can be passed to the baby through breast milk, increasing the risk for problems with brain development. One longitudinal study showed that prenatal marijuana exposure had significant effects on the developing central nervous system in children and adolescents, with higher rates of attention deficit disorders and impulsivity at ages 3, 6, and 14 years, poorer academic performance, and higher rates of delinquency at ages 6, 10, 14, and 16 years, was linked with marginally more depressive symptoms and poor performance on memory and visual planning tests in 10-year-olds. And at age 14 years, exposure to marijuana in the womb predicted problems with sustained attention, cognitive flexibility, and response suppression. And use during pregnancy can lead to an increase in miscarriage or spontaneous abortion. Scientists suspect that excess levels of anandamide, a substance which occurs naturally in the body but is one of the chemicals released when cannabis is burned, is the factor leading to miscarriage. Another study suggests that women who smoke marijuana during pregnancy may put their child at risk for lasting mental defects, including lower memory retention scores, and memory impairment seem to be a persistent condition present at both 40 and 80 days of age. And again, these difficulties appear to persist into adolescence when they may be accompanied by increased depression and anxiety, along with reading and spelling problems and general underachievement at school. Such deficits may also continue into early adulthood, along with an increased risk for initiation of tobacco and marijuana use. Research also found a 10-fold increase in the risk of non-lymphoblastic leukemia in children, and marijuana may also increase the risk of other childhood cancers and even of chromosomal damage, including breakage and translocation, although this damage seemed to be confined to somatic cells. And in animal studies, it was shown that maternal exposure to even low doses of cannabinoid compounds results in atypical local motor activity, cognitive impairments, altered emotional behavior, and enhanced sensitivity to drugs as adults. And other studies have shown that marijuana may seriously affect fetal development, including major malformations such as smaller head circumference, mutations, poor autonomic control, cognitive alterations, behavioral disorders, and birth defects, including even a hole in the heart, ventricular septal defect, all depending on the dose and duration of use. There is also increasing evidence showing that cannabinoid drugs are neuroteratogens, which induce enduring neurobehavioral abnormalities in the exposed offspring. And research also suggests that marijuana use during pregnancy may be associated with an increased risk of sudden infant death syndrome, SIDS, in their infants. Of course, not every baby will experience all of these effects, and virtually all of these studies did suggest that dose and duration of use were primary determinants. But nonetheless, these are serious and significant findings from what many people consider to be a safe or harmless drug. And again, prevention is the best medicine, especially if you are a parent who wants to protect your new baby. Hey, be safe, be well, and remember, your child deserves the best chance for health and wellness they can possibly get. Your child cannot say no to drugs, but you can. And that means first and foremost, staying drug-free, especially if you're pregnant. And may God bless.